Osteoporosis: symptoms, causes, prevention, and treatment. Osteoporosis is a bone disease that causes a loss of bone density, which makes bone weak and fragile. This greatly increases the risk of bone fracture even after a minor fall or bump. The inside of a healthy bone has small spaces, like a honeycomb. Osteoporosis increases the size of these spaces, causing the bone to lose strength and density. In addition, the outside of the bone grows weaker and thinner. Osteoporosis can occur in people of any age, but it occurs more in older adults, especially women. More than 53 million people in the United States either have osteoporosis or are at a high risk of developing it. People with osteoporosis are at a high risk of fractures or bone breaks while doing routine activities such as standing or walking. The most commonly affected bones are the ribs, hips, and bones in the wrists and spine. Osteoporosis is not usually painful until a bone is broken, but broken bones in spine are a common cause of long-term pain. Although a broken bone is often the first sign of osteoporosis, some older people develop the characteristic stooped bent forward posture. It happens when the bones in the spine have broken, making it difficult to support the weight of the body. Symptoms of osteoporosis. The early stages of osteoporosis don't cause any symptoms or warning signs. In most cases, people with osteoporosis don't know they have the condition until they have a fracture. If symptoms do appear, some of the earlier ones may include receding gums, weakened grip strength, weak and brittle nails. Bones affected by osteoporosis may become so fragile that fractures occur spontaneously as a result of minor falls, such as fall from standing height, that would normally not cause a break in a healthy bone. Normal stresses such as bending, lifting, or even coughing. If you don't have symptoms but have a family history of osteoporosis, talking to your doctor can help you assess your risk. Severe osteoporosis. Without appropriate treatment, osteoporosis can worsen. As bones get thinner and weaker, the risk of fracture increases. Symptoms of severe osteoporosis can include a fracture from a fall or even from a strong sneeze or cough. They can also include back or neck pain or loss of height. Back or neck pain or a loss of height can be caused by a compression fracture. This is a break in one of the vertebrae in your neck or back, which is so weak that it breaks under normal pressure in your spine. If you do have a fracture from osteoporosis, how long it takes to heal will depend on many factors. These include where the fracture is, how severe it is, as well as your age and health history. Causes of osteoporosis. Losing bone is a normal part of aging, but some people lose bone much faster than normal. This can lead to osteoporosis and an increased risk of broken bones. Possible causes of osteoporosis include certain medical conditions, such as hyperthyroidism. They also include the use of certain medications. Examples of these medications include the use of long-term oral or injected corticosteroids, such as prednisone or cortisone. Risk factors for osteoporosis. Many people with osteoporosis have several risk factors, but others who develop the condition may not have any specific risk factors. There are some risk factors that you cannot change, and others that you may be able to change. However, by understanding these factors, you may be able to prevent the disease and fractures. These risk factors include age. The biggest risk factor of osteoporosis is age. Throughout your life, your body breaks down old bone and grows new bone. However, when you are in your 30s, your body starts breaking down bone faster than it's able to replace it. This leads to bones that are less dense and more fragile, and thus more prone to breakage. Menopause. Menopause is another primary risk factor, which occurs in women around the ages of 45 to 55 years. Due to the change in hormone levels associated with it, menopause can cause a woman's body to lose bone even more quickly. Women are more at risk of osteoporosis than men, particularly if the menopause begins early, before the age of 45, or they have had their ovaries removed. Men continue to lose bone at this age, but at a slower rate than women do. However, by the time they reach the ages of 65 to 70, women and men are usually losing bone at the same rates. Many other factors can also increase the risk of developing osteoporosis. This includes being female, being Caucasian or Asian, having a family history of osteoporosis, particularly a hip fracture in a parent, poor nutrition, physical inactivity, smoking, small bone frame, long-term use of certain medicines that can affect bone strength or hormone levels, such as anti-estrogen tablets that many women take after breast cancer, having had an eating disorder such as anorexia or bulimia, having a low body mass index, BMI, other medical conditions such as inflammatory conditions, hormone-related conditions, or malabsorption problems. You can control some of these risk factors for osteoporosis, such as poor nutrition and inactivity. For instance, you can improve your diet and start an exercise program that can benefit your bone health. However, However, you can't control other risk factors, such as your age or gender. Senile osteoporosis. You may have heard of senile osteoporosis. This is not a separate type. It's simply osteoporosis that's caused by aging, when other possible secondary causes are excluded. As earlier mentioned, age is a primary risk factor of osteoporosis. Unless proper prevention or treatment efforts are made, your body's increasing breakdown of bone can lead to weakened bones and osteoporosis. According to global statistics from the International Osteoporosis Foundation, about 1/10 of women aged 60 have osteoporosis, while 2/5 of women aged 80 have the condition. Osteoporosis versus osteopenia. If you are told that you have osteopenia by your doctor, you may think you misheard the word osteoporosis. However, osteopenia is a separate condition from osteoporosis. Unlike osteoporosis, osteopenia is not a disease. Rather, it's a state of having low bone density. With osteopenia, your bones are not as dense as normal, but they are not as weakened as they are if you have osteoporosis. The main risk factor for osteopenia is older age. Your bone density peaks at age 35, and after that, it can lessen as you get older. In many cases, osteopenia can lead to osteoporosis, so if you have osteopenia, you should take steps to strengthen your bones. Bone density test for osteoporosis. To check for osteoporosis, your doctor will review your medical history and do a physical exam. They may also run tests of your blood and urine to check for conditions that may cause bone loss. If your doctor thinks you have osteoporosis or that you are at risk of developing it, they will likely suggest a bone density test. This test is called bone densitometry or dual energy X-ray absorptiometry (DEXA). It uses X-rays to measure the density of the bones in your wrists, hips, or spine. These are the three areas most at risk of osteoporosis. This painless test can take from 10 to 30 minutes. Osteoporosis prevention. There are many risk factors for osteoporosis that you cannot control. These include being female, getting older, and having a family history of osteoporosis. There are some factors, however, that do fall within your control. Some of the best ways to prevent osteoporosis include getting recommended daily amount of calcium and vitamin D, doing weight-bearing exercise, stopping smoking. For women, weighing the pros and cons of hormone therapy. If you are at risk of developing osteoporosis, talk to your doctor about the best way to prevent it. Osteoporosis diets. An appropriate diet can help strengthen your bone in addition to your treatment plan. To keep your bones healthy, you need to include certain nutrients in your daily diet. The most important ones are calcium and vitamin D. Your body needs calcium to maintain strong bones, and it needs vitamin D to absorb calcium. Other nutrients that promote bone health include protein, magnesium, vitamin K, and zinc. Exercises for osteoporosis. Eating right is not the only thing you can do to support the health of your bones. Exercise is very important as well, especially weight-bearing exercises. Weight-bearing exercises are performed with either your feet or arms fixed on the ground or another surface. Examples include climbing stairs, resistance training such as leg presses, squats, push-ups, weight training such as walking with resistance band, dumbbells, resistance exercise machines. These exercises help because they cause your muscles to push and pull against your bones. This action tells your body to form new bone tissue, which strengthens your bones. This is not your only benefit from exercise. However, in addition to many positive effects on weight and heart health, exercise can also improve your balance and coordination, which can help you avoid falls. Always check with your doctor before starting new exercise program. Osteoporosis treatment. If your testing shows that you have osteoporosis, your doctor will work with you to create a treatment plan and will likely prescribe medications as well as lifestyle changes. These lifestyle changes can include increasing your intake of calcium and vitamin D, as well as getting appropriate exercise. There's no cure for osteoporosis, but proper treatment can help protect and strengthen your bones. These treatments can help slow down the breakage of bones in your body, and some treatments can spur the growth of new bones. Osteoporosis natural treatments. Because osteoporosis medication can have side effects, you may prefer to try other treatments instead of medication. Several supplements such as red clover, soy, and black cohosh may be used to promote bone health. However, before using these supplements, be sure to talk to your doctor or pharmacist. This is for two main reasons. There are few, if any, studies supporting the use of this supplement for treating osteoporosis. As a result, we don't have proof that they work. The supplements can cause side effects as well as interact with medications you are taking. You will want to make sure that you know what side effects could occur and if taking any medications could interact with the supplements. All of that said, some people report good results with the natural treatments. Osteoporosis medications. The most common drugs used to treat osteoporosis are called bisphosphonates. Bisphosphonates are used to prevent the loss of bone mass. They may be taken orally or by injection. They include alendronates, albendronates, risdronates, zolendronic acid. Other medications may be used to prevent bone loss or stimulate bone growth. These include testosterone. In men, testosterone therapy may help increase bone density. Hormone therapy. For women, estrogen used during and after menopause can help stop bone density loss. Unfortunately, estrogen therapy has also been associated with increased risk of blood clots, heart disease, and certain types of cancer. Raloxifene. This medication has been found to provide the benefit of estrogen without many of the risks, although there is still an increased risk of blood clots. Denosumab. The drug is taken by injection and may prove even more promising than bisphosphonates at reducing bone loss. Teriparatide. The drug is also taken by injection and stimulates bone growth. Calcitonin salmon. This drug is taken as a nasal spray and reduces bone reabsorption. Talk to your doctor about any increased risk of cancer with this drug. Romosozumab. This medication was approved by the FDA in April of 2019 to treat women who have gone through menopause and are at high risk of having fractures. The drug is given in 2 injections under the skin in the same sitting once a month for 12 months or less. It has a black box warning because it may increase the risk of heart attack or stroke, so it's not recommended for people with a history of either. Conclusion. Osteoporosis can have serious side effects. It can lead to fractures which can be painful, take a long time to heal, and lead to other complications. For instance, treatment from a hip fracture can include staying in bed for a long period, which raises the risk of blood clots, pneumonia, and other infections. The good news is, there's a lot you can do both to prevent and treat osteoporosis, from eating right and exercising to taking appropriate medications. Talk to your doctor if you think you are at risk of osteoporosis or if you have been diagnosed with it. They can work with you to put together a prevention or treatment plan that can help improve your bone health and reduce the risk of complications from osteoporosis. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more content like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.